Hi GOTA members, looking to prepare for an exam or simply test your clinical knowledge? This video's for you! Welcome to the Georgia Occupational Therapy Association subluxation quiz. Define a shoulder subluxation. A shoulder subluxation is partial or incomplete dislocation of the glenohumeral joint, or translation between the humeral head and the glenoid fossa, while the humeral head is in contact with the glenoid fossa. What causes a subluxation? A subluxation is caused by weakness of the rotator cuff muscles or laxity of the glenohumeral ligaments. This weakness or laxity of the glenohumeral ligaments allows the humeral head to easily slip out of the glenoid fossa and result in glenohumeral subluxation. Name 3 etiologies of shoulder subluxation. The 3 etiologies of shoulder subluxation are traumatic, non-traumatic, and neuromuscular. What are Tubbs syndrome and AMBRI syndrome? Tubbs syndrome and AMBRI syndrome are patterns of shoulder instability. What does Tubbs syndrome stand for? Tubbs stands for traumatic, unilateral dislocation with a Bankart lesion, often requiring surgery. What does AMBRI syndrome stand for? AMBRI stands for atraumatic, multidirectional, bilateral shoulder subluxation or dislocations, often treated with rehabilitation. Name at least 3 common causes of neuromuscular subluxations. Three common causes of neuromuscular subluxations include stroke, cerebral palsy, brachial plexus injury. Shoulders can sublux in 3 directions: inferior, anterior, or posterior. What is the most common direction of a subluxation for a neuromuscular injury? The most common direction of subluxation for a neuromuscular injury is inferior, but over time, if a person experiences spasticity of the internal rotation muscles, the lats, the pecs, and the subscap, posterior shoulder subluxations are the most common. The internal rotation muscles will gradually result in a backward tendency of the humeral head, resulting in posterior shoulder subluxation. Describe how OTs check for subluxation. Physical examinations bilaterally to the shoulder joints should occur. This should include palpation of the glenohumeral joint, inspection of the shoulder contours, active and passive range of motion, and motor and sensory testing. Once a subluxation is identified, further testing can be completed to determine severity and type of laxity. How do OTs document a subluxation? The extent of subluxation is quantified by distance from the acromion to the humeral head using finger breadth, caliper, or a measuring tape. Describe the common treatment for a traumatic shoulder subluxation. The treatment for a traumatic shoulder subluxation includes ice to reduce the swelling, avoiding postures leading to recurrent subluxation, and wearing a protective sling. If pain occurs, medications can be used. The patient should also start passive or active range of motion exercises for the upper limb and scapular stabilization exercises. If these interventions are tolerated, the patient should progress to strengthening of the shoulder girdle muscles and glenohumeral joint proceptive training to improve stability. Describe the common treatment for the atraumatic shoulder subluxation. Treatment of the atraumatic subluxation by an OT focuses on progressive strengthening of the rotator cuff, deltoid, and scapular stabilization muscles. The OT should also check for ways to modify common upper extremity movements to improve coordination. Describe the common treatment for neuromuscular subluxation. During the acute stage, functional electrical stimulation should be used to reduce the shoulder. Shoulder supports such as bow bath, roll-in humeral cuff, give more, or a standard hemi-sling should be used to reduce shoulder subluxation and prevent further soft tissue involvement. If the patient is non-ambulatory, the wheelchair should reduce subluxation. Preventing further subluxation in the neuromuscular subluxation is essential. Similar to the treatment of other subluxations, active and/or passive range of motion exercises for the upper limb should occur with scapular stabilization. Patients should then progress to active strengthening of the rotator cuff muscles, the deltoid, and scapular stabilization muscles. Name 2 to 3 modalities that OTs can utilize to address upper extremity pain during the acute and chronic presentations of shoulder subluxation. Modalities that OTs can utilize to address upper extremity pain during the acute and chronic presentations of shoulder subluxation include transcutaneous electrical nerve stimulation, or TENS, electrical stimulation, ES, ice in the acute phase, moist heat in the chronic phase, and ultrasound. This quiz is based on the following article. Check out an additional multiple choice quiz based on the article by clicking the hyperlink. The additional quiz is located at the bottom of the article. Thanks for tuning in. Comment below for additional quiz topics for the GOTA to cover.